Hi, I'm Eve, and this is my presentation on complementary medicine in cancer care, when East meets West. What is complementary medicine? According to the National Center for Complementary and Integrative Health, complementary medicine is anything that's non-mainstream given alongside traditional medicine. Types of complementary medicine include 4 different varieties: nutritional, psychological, physical, and a combination thereof. Some examples of nutritional include supplements and traditional Chinese medicine. Psychological would be meditation and music therapy. Physical, acupuncture and massage. And combination, yoga and tai chi. Beretta reports that for the last 30 years, physicians have overwhelmingly ignored complementary medicine. Then, in 1997, the American Society of Clinical Oncology, or ASCO, presented an article, and it described complementary medicine as unorthodox or questionable methods. This was the first time that oncology ever addressed complementary medicine, albeit in a paternalistic and precautionary way. Then, in 2001, the Journal of Clinical Oncology advised that academic oncology has no other recourse besides to address complementary medicine. The tone of this article went from paternalistic to benign tolerance. However, Kimball further cautions that talking about complementary medicine in terms of disclosure only and couching it as a risk behavior threatens to alienate the patient. So do patients actually utilize complementary medicine? It turns out they do. Hornaber states that approximately 50% of patients with a cancer diagnosis will pursue complementary medicine. This is an increase from the 1970s when only 25% used it. The majority of those who use complementary medicine learned about it not from their physician, but from the media, friends, and other patients. In fact, only 5.9% spoke with a physician about their complementary medicine. Generally, they won't even disclose that they're using it to their physician. This could be because the topic was just never broached with their provider, or they fear a negative reaction or think that their physician simply has no information about complementary medicines. This is a table by Beretta, and as you can see, almost 50% of the information patients glean about their complementary medicine is from the media, with far less gleaned from their doctor. Why do patients use complementary medicine? Al-Sharif performed a literature review that showed there are many various reasons that patients pursue it. They could be searching for a cure. They could be seeking relief from side effects. They want to improve their immune function. They may want to improve overall health and well-being. They also may be disappointed in the traditional approach to medicine, from which they could be having significant side effects and symptoms. They may be trying to avoid surgery. Plus, complementary medicine is very accessible and sometimes much cheaper than traditional treatments. From a physician perspective, clinicians need to be aware when patients utilize complementary medicine. And this is because particularly the oral herbal treatments can conflict with cancer treatments or can cause increased likelihood of toxicity. Beretta reports that 67% of these treatments self-prescribe, and most are not aware of potential side effects. Beretta performed an interview of 438 physicians in Italy about their opinion on complementary medicine. Not surprisingly, 44% felt that they would only prescribe Western traditional medicines, but 59% also reported an acceptance of complementary medicine and said that they would prescribe it for interested patients. 45% said that complementary medicine could have a significant role alongside traditional medicine. This level of acceptance increased from 48% as cited by Crossetti in 1996. What are the clinical benefits of complementary medicine? Lin addressed this by stating that the overall effect of his literature review demonstrated clearly superior efficacy when using complementary medicines. He was looking at quality of life primarily. Chinese herbal medicine and Qigong plus mindfulness were particularly efficacious in his studies. Emotional and physical well-being were improved by yoga. Calcagni found that manipulative and body-based practices offered improvement of cancer-related symptoms, Reflexology and massage or acupressure showed notable reduction in pain and anxiety. Pain and fatigue were the symptoms that were most impacted. Beretta also found only 3.9% of patients reported side effects related to this complementary treatment. What do we do to implement complementary medicine into our cancer care system? The first object would be to provide comprehensive training for providers so that they can guide their patients. We also need to improve the quality of studies. Lynn advised there is far more information available for breast cancer, which of course predominantly affects women. There are far fewer studies in the most common cancer, which is lung, and only 8% of the trial participants were male. Oncology centers should develop a method for vetting these complementary providers as well, and this can help patients choose their practitioners. Rogi states that patients may feel lost in attempting to determine who is a safe and effective provider without provider help. An alternative would be for a large center to have their own internal method, in which case they can provide their own vetted practitioners. In conclusion, patients want to incorporate complementary medicine alongside traditional for a number of reasons. Providers need to know when this happens so that they can assist their patients. Next steps presented in this presentation can help develop the mutually beneficial relationship between East and West medical practices for the benefit of everyone. Thank you so much.